This is a general disclaimer. Redlands Community College attempts to have the most accurate and up-to-date information listed in its content and delivery. However, your education is your responsibility. Redlands Community College or Roy Smith makes no guarantee in the accuracy of this information in this video and accepts no liability for the informational video. The information expressed is strictly the opinion of the author and the presenter, which is listed in the reference near the end of the video. This information is designed to supplement your own education or initial education and should not be used to replace any current academic program you're enrolled in. View the information and content at your own risk. Thank you.
This is going to be Chapter 32, Disorders of Unexplained Weight Loss. Key concepts. Upon completion of this chapter, you will understand these concepts: how medical care shifts from curative care to comfort care in the terminal stage of disease, how signs and symptoms common to the terminally ill patient may not indicate the terminal event and should be assessed and treated as appropriate, that management of pain is a key component of end-of-life care, how care extends to the family. Chief concern: generalized weakness and unexplained weight loss, end stage in several diseases to include, but not limited to, tuberculosis, AIDS, and cancer. Care focuses less on the cure and more on the care. Tuberculosis has declined in the U.S. Still a major mortality cause, though, worldwide. That would be from AIDS-ridden and war-ravaged countries. It's an opportunistic infection. It competes with the body for energy. Patient begins to waste away. Extrapulmonary tuberculosis, or tuberculosis outside of the lungs. Tuberculosis spreading into other organs beyond the lungs. There's also renal tuberculosis. Disseminated tuberculosis enters the kidneys and progressively destroys the renal parenchyma until the kidney fails. Can also spread to the adrenal glands just superior to the kidneys, leading to destruction of the adrenal cortex and the development of Addison's disease. Acquired immunodeficiency syndrome. Human immunodeficiency virus, or HIV, eventually can develop into AIDS, or acquired immune deficiency syndrome. AIDS-related complexes, frequently seen in early AIDS. We get immune system destruction. Permits opportunistic infections in the end stage. This example of this would be a class 4 AIDS. Table 32-1 and 32-2 we're going to take a look at here in the next couple slides. This is 32-1, which are the clinical findings of AIDS-related complex, unexplained weight loss, generalized fatigue or malaise, high fever, where there be intermittent or continuous, persistent diarrhea with unknown cause, and then night sweats. All of these are clinical findings in AIDS-related complexes. Table 32.2 in your book, pathology associated with stage 4 AIDS, HIV wasting syndrome, the opportunistic infections. We get a certain type of opportunistic infections that we see more often: pneumocystitis pneumonia, toxoplasmosis, cytomegalovirus, and then extrapulmonary tuberculosis. Tuberculosis in the kidneys and other organs. Cancers that we see are lymphomas and Kaposi sarcoma. Cancer, found in every organ and tissue. It's an umbrella term. Disorder with disorganized cell growth is essentially what it is. An abnormal growing cell. Normal circumstances, cell growth and death are controlled by the DNA. Cell behavior, uncontrolled division of the cell, the loss of control of cell apoptosis or cell death, usually due to damage in the mutated DNA is why that occurs. Cancer continued. Many types seem to have a genetic link. An example of this would be breast cancer. Progression, we get the mutated cell grows, the mass starts to appear, we get a primary tumor, initial uncontrolled cell growth, and then it can become metastatic or metastasis. Cancer growth spreads into other parts of the body. And table 32-3 is cancer terminology, which is the next slide. Carcinomas occur, and this is in epithelial cells, breast, prostate, lung, colorectal, ovarian, bladder, pancreatic, and endometrial. And these little things here, the plus, most common cancer in women, is breast, prostate, most common cancer in men, lung, which is the doubles, most common cause of cancer mortality in men, and most common cause of cancer mortality in women. So lung cancer would be the winner of the cancer, so to speak. Sarcoma, connective tissue cancer. We get lymphomas, leukemias, and melanomas out of this. Blastic or embryonic neuroblastoma is an example of this. Cancer staging. We have essentially 0 through 4 of the tumors, and we'll kind of go over this here just a little bit. Nodes, again, 0 through 4, depending on how severe they are. And as far as metastasis goes, and this would mean transferring to another organ system, is it metastatic or is it not? So if it is not metastatic, it gets an M0. If it is metastatic, it gets an M1. So an example of this, a woman with a lump in her breast that was positive to be cancerous, and it transferred into her axillary node or the axilla node. The axilla node was tested and also had cancer cells in it. Then she would be graded as a tumor 2. This is an example from the book. Tumor 2, node 1, and it was not metastatic. A metastatic is 0. So they grade the tumorous areas just like we would grade other things, +3, +4 periodema, and so on. Cancer treatments and modalities on this. Surgery would be one of the treatments, and this would be to provide tumor removal. Radiotherapy is also another one. Focus energy to kill the cancer cells in a specific area or target tissue, while sparing the rest of the body. Chemotherapy, treatment of disease by chemicals, and this is kind of systemic whenever we use chemotherapy, so that's not the only cell that it kills. Supplementary treatments would be things like integrated medicine or non-traditional medicine, blending of traditional and complementary medicines, relaxation, and things like this. Acupuncture, remission is a term, disease-free state, but the cancer can return even after remission. And then prognosis is a predicted outcome of the disease. Those are all terms related to cancer. End-of-life care, and this is called palliative care or palliative care, reduces suffering and improves the quality of life without prolonging the inevitable. Hospice, a place for rest for weary travelers, has become a place of rest for the terminally ill, provides a multidisciplinary team, and on hospice, you qualify with a certain specific disease process, and they care for you underneath that disease umbrella. Just because they're in hospice means that we do not treat. Just because someone has a DNR doesn't mean that we do not treat. We just are going to look and see if there's any legal ramifications of our initiation of treatment. So if they do have a DNR, we will take their wishes into considerations. Now, an Oklahoma DNR means a do not resuscitate order. And if there's any question ever on the DNR, we should always confer with the receiving, or what would be the receiving, medical control. History, triad of symptoms. Things like anorexia, weight loss, malaise. Anorexia is a generic term, an eating disorder characterized by a lack of desire to eat, not like whenever most people think of anorexia, they think of anorexia nervosa, but anorexia means nothing more than a lack of desire to eat. Malaise, generalized discomfort associated with being unwell. Additional symptoms may also be nausea and night sweats in their history. On examination, signs associated with cancer. The paraneoplastic syndrome, physical signs that are a result of the cancer's effects on the nervous system. Purpura is another one, which is bleeding underneath the skin. Pancytopenia, the absence of red blood cells, which we generally consider anemic or anemia. the absence of white blood cells, or leukocytopenia, and the absence of platelets, which would be thrombocytopenia. Concomitant platelet deficit, especially if they're on types of chemotherapy. And then leukocytopenia, which is a decline in the number of circulating white blood cells, which makes them more immunosuppressed, or makes them more opportunistic for bacteria. Assessment: cachexia, which is a wasting syndrome, classic triad of symptoms as well: loss of appetite, loss of weight, and malaise, induced by the inflammatory cytokines of the body, inability to make proteins, and that includes immunoglobulins, which essentially are antibodies, or they have the ability to initiate specific immune responses. So it, again, depresses your immune system. As far as treatment of cachexia, largely supportive. Shortness of breath, we treat it with oxygen. The nausea, we should treat with antiemetic medications, things like Zofran or Phenergan, if we have it on the truck, whatever antiemetic medication may be. Upon evaluation, pain management plans are 3-tiered. First tier are non-narcotic anti-inflammatory medications like ibuprofen. Second tier, opiate combinations with NSAIDs, synthetic narcotics such as propoxyphene and methylmorphine. The third tier of this is opiates like morphine, Dilaudid, and so on. Help assure a painless passage is what these medications are for. Breakthrough pain, which is several episodes of pain a patient may experience even though he's on an opiate regimen. Breakthrough pain, we should try to alleviate their pain as best we can with preferably a fast-acting opiate. And what I mean by fast-acting is it doesn't stick around forever. So the half-life on it is short. Requires more than regular anesthesia is the process on this for the breakthrough pain. So no matter, or analgesia. So even though they're in pain and they're on a pain regimen, if they have breakthrough pain, we should treat that with opiates per protocol. Disposition. Patients with cancer routinely transferred to a local hospital. Many request hospital with a palliative care unit. Teams familiar with cancer care is what this would be. Currently, 55% of the hospitals in the United States with over 100 beds have a palliative care unit available. In conclusion, cancers and infectious diseases like HIV and tuberculosis are conditions that cause several generalized symptoms. Examples of this would be weight loss and night sweats. The immune system becomes depressed from the chronic disease, opening the door for opportunistic infections to take hold and complicate the patient's care. In some instances, the paramedic will be called upon to assist with end-of-life care for a patient suffering from cancer. Compassionate care will help provide comfort for the patient and the family. References were taken from Myers, Professional Paramedic, Medical Emergencies of Del Mar Learning. And if you have any questions concerning this chapter, feel free to give me a call. My name is Roy Smith, roy.smith@redlandcc.edu or 405-219-7613. Thank you.